Hi, I'm Dr. Amy McMichael, professor of dermatology at Wake Forest University School of Medicine in Winston-Salem, North Carolina. I'm also a hair loss expert and have been having a hair loss clinic for the last 31 years. I'm very excited to talk to you today about Deuruxolitinib, a recently approved, FDA-approved drug for alopecia areata. This medication is a deuterated form of ruxolitinib. The ruxolitinib has been approved for many years for non-dermatology uses, but Deuruxolitinib has been shown to be very effective in preclinical trials. And for the most recent data that has come out is that the two Thrive AA trials, Thrive AA1 and Thrive AA2, has shown Deuruxolitinib to be very, very good medication for those with alopecia areata compared to placebo. So let's talk about the trials a little bit. Both trials were trials that used both placebo drug, 8 milligram twice daily, and 12 milligram twice daily. Unfortunately, the company chose to not go forward with the 12 milligram twice daily dosing. However, when we look at the data outcome from the trials, we see that in both Thrive AA1 and Thrive AA2, the patients compared to placebo were already improving a statistically significant way by 8 weeks. So that's pretty impressive. Both the 8 milligram and the 12 milligram. Now, as the trial went on, past to the 24-week mark, both the 8 milligram dosing and the 12 milligram dosing were statistically significantly better than placebo. And the 12 milligram was even better than the 8 milligram. But again, the 8 milligram twice daily doses is what has been approved. So let's just clarify who was in the trial. This trial was adults only, so everybody was 18 years of age and older. And there were patients of different ethnicities, different races, so a bit of a mixed trial, but not significantly diverse. And what we know now is that the trial has long-term data coming out soon because there was a long-term open access trial. So the patients were all on drug after they completed the trial. So we look forward to more data. What we also know about the patients in the Thrive AA1 and Thrive AA2 initial trials that were used for FDA approval is that the patients did not have any significant medical side effects or complications, no significant serious adverse events. There certainly was, as in all of the JAK inhibitor trials for alopecia areata, those who had issues with zoster, herpes zoster, and herpes simplex. So we always talk to our patients about getting herpes zoster vaccinations prior to going on a JAK inhibitor. That was not a requirement for this trial. And there were some scattered here and there non-serious upper respiratory tract infections, that sort of thing. But as far as serious adverse events, we didn't see those. So this medication is going to be now adding to our armamentarium of now 3 total approved JAK inhibitors for our alopecia areata patients with severe alopecia areata. So please do look at these medications for your patients with severe disease, because we don't want to be doing outdated things like systemic long-term oral or intramuscular corticosteroids. Those are not safe for our patients, and we're getting more and more data on our JAK inhibitors, and we absolutely know that these drugs are helping our patients, not just in growing back their hair on their scalp, but also growing back their hair on their eyebrows and eyelashes, and also improving their quality of life. So let's move forward with using these medications for our patients. And now you know about Deuruxolitinib and how well it works for our patients in an 8 milligram twice daily dosing.